Hi, this is Dr. Michael Lenz. I'm doing a reaction video to a naturopath who said that you should not accept fibromyalgia as a diagnosis. This is a common sentiment that many people who have fibromyalgia may have. I had a recent patient of mine, and I was taking her history, including her family history, and she shared that her mom actually had been previously diagnosed with fibromyalgia, but said, I don't know if she even believes that she has it anymore, and where she ended up going to a pain management doctor who said that all of her problems were caused by disc herniations and that this doctor could fix them by doing injections of the back. I'm Dr. Michael Lenz, host of this YouTube channel, Conquering Your Fibromyalgia, and the Conquering Your Fibromyalgia podcast and book. I'm a medical doctor, boarded in pediatrics, internal medicine, as well as a diplomat of the boards of clinical lipidology and lifestyle medicine. And my goal is to bring an evidence-based information to help those who are struggling with the chronic invisible illnesses, including fibromyalgia and other related conditions. So let's dive into this video.
And today we are talking about fibromyalgia. And fibromyalgia is not an acceptable diagnosis. When I said this on TikTok, it caused quite a stir, quite a controversy. People were like, what do you mean it's not acceptable? Are you saying it's not real? How dare you say it's not real? It's people like you who make it difficult for us. Did I say that? Did I say it's not real? Or did I say it's not an acceptable diagnosis? What I said and what I am saying right now, today, and forever is that the fibro diagnosis isn't an acceptable diagnosis. Why? Because you should want more. Now, if you're here today, you're here for one of two reasons. You or someone you love received the diagnosis of fibromyalgia. All your various symptoms, and maybe you're pretty sure you have fibromyalgia because, you don't feel good. I'm here to tell you, do not accept this diagnosis. So today, I'll tell you what fibro is, how it's diagnosed, what the treatment is, and why all of that is not enough. Fibro is called an invisible illness for two reasons. First, the symptoms are not visible. People can't see your pain. Your labs are normal. You're in distress and no one can see it from the outside. It's invisible. But the second reason it's called invisible is because after a while, you feel invisible. After going from medical provider to medical provider, being told that you're fine, there's nothing wrong with you. If you hear that enough over time, you will start to feel invisible. So that's why it's called the invisible symptom. Now, if you receive the diagnosis for fibro, you might for a moment feel like, oh my God, this is great news. Finally, someone sees me. I have a diagnosis. I'm not crazy. However, you'll soon discover the diagnosis of fibromyalgia makes you more invisible, because it means that from this point forward, any medical provider will stop searching. You'll be branded as the patient with fibro, and you will become even more invisible.
She shares that you feel invisible, and that's correct. A lot of people who have these often feel invisible. They feel like they're not listened to, and they're not getting the help they deserve. This doctor of naturopathy claimed that fibromyalgia isn't an acceptable diagnosis. Now, she insists she's not saying fibromyalgia isn't real, but she says you should never accept the diagnosis because it supposedly means your doctors have given up. As someone who spent years treating people with fibromyalgia and other invisible illnesses and investigating chronic pain, I want to unpack this carefully. What does she get right about this frustration so many people feel? And where does this narrative go off the rails into misinformation that actually harms patients?
And trust me, I know, a practicing nurse practitioner for decades. Many of my colleagues literally roll their eyes when the patient comes in with a diagnosis of fibromyalgia. You're branded as a problem patient. Fibromyalgia is a diagnosis given when they can't figure out what it is. This is called a diagnosis of exclusion. That means they test you for everything else, and then they say, I don't know, let's just call it fibro. Sounds like a problem already. So the next question a lot of people like to ask me is, how do you diagnose fibromyalgia? Well, that's the thing. You don't really diagnose it. I mean, you do, but you don't. And that's exactly the problem. As I said earlier, it's a diagnosis of exclusion, which means your conventional medicine provider will do all of the tests, everything they can think of. And when everything comes back negative, that means they exclude all other possibilities. They will assume you have fibromyalgia. That's what a diagnosis of exclusion means. It's an entire process, and it ends with, we can't find anything else, so you must have this. Okay, bye. How could this be enough? If they land on fibro, you just say, thank you so much. And then you move on into functional medicine. It's just a label. and no answers with it. So the next question is, what causes fibromyalgia? Like how did I get this? And that depends on who you ask. The usual answer would be like, maybe it's a genetic predisposition, but I'm thinking, and I'll tell you more about it, that it's not genetic that you have fibro, but maybe it's genetic that you're sensitive to gluten or mold or something like that. So no one really knows why in conventional medicine. But here's the thing, we're going to talk about the why, because once we start looking at different whys, we could see why fibromyalgia just doesn't cut it. Because so far you're getting that fibromyalgia is a disease diagnosed, nothing else is found. No one knows the reason why. If you have a disease that is diagnosed because we can't find anything and no one knows why, how effective do you think the treatment's going to be? It's not, there's no way it could be effective because you don't even know what you're dealing with. So I hope that's clear to you, that if you get diagnosed with fibromyalgia, which is a diagnosis of I don't know, how could you possibly think the treatment is going to help you? I do not want you to have a diagnosis of exclusion. I do not want you to get medication thrown at you. I want you to have answers and find the reasons behind why you're feeling this way and getting your life back. I am not selling you a 90-day protocol miracle cure, okay? I don't care if you sign up to work with me. In fact, pretty hard to book a consult with me. I make it pretty hard to do that. I'm talking about this because I care and I want everyone to have access to information. Here's the bottom line about fibromyalgia in functional medicine. The bottom line is fibromyalgia is not the end diagnosis. It's actually just the beginning of the journey. Let me tell you what I mean by this. And by the way, this is just how it is in functional medicine.
Let's talk about it. You feel invisible. She's right about that. People with fibromyalgia do often feel invisible. You can't necessarily see the pain on traditional static MRIs or X-rays or a lab result, and too many clinicians still roll their eyes at the diagnosis, or worse, simply imply it's all psychological, a figment of your imagination. So yes, her compassion here is genuine and important. And she's also right that fibromyalgia is a diagnosis of exclusion. There's no single blood test that proves you have it. It's based on symptoms and ruling out these other conditions. But that doesn't mean it's a garbage can diagnosis or somehow unacceptable. In medicine, many complex conditions from chronic fatigue syndrome to migraines started out as diagnoses of exclusion until we learn more about their underlying biology. And fibromyalgia definitely fits into this. Where she goes off track. Do not accept this diagnosis. Here's where this message becomes dangerous. Telling people not to accept their diagnosis feeds the idea that fibromyalgia isn't legitimate. That's not empowering. It's invalidating. Just dressed up functional medicine language. Fibromyalgia isn't a placeholder for we can't find anything. It's a well-described nociplastic pain syndrome where fibromyalgia epitomizes that, formerly known as central sensitization syndromes. It's a disorder of how the brain processes things differently. Functional neuroimaging studies have shown amplified pain signaling even from mild stimuli. Research shows disrupted deep sleep interrupts someone's ability to wake up and feel rested. And genetics show differences in neurotransmitter systems like serotonin and dopamine. So when she says you should want more than a fibromyalgia diagnosis, I actually agree with that, but not because the diagnosis is wrong. You should want more understanding of what fibromyalgia really is and how to manage it effectively.
But the reason they don't feel well is because they have issues that conventional medicine doesn't test for. So just like every chronic illness, fibromyalgia has triggers, right? It could be physical, emotional trauma, infections, hormonal changes, stress. And these triggers can lead to an overactive pain response. Pain is our main issue. So let's talk about these triggers because finding these out can make all the difference. One of them you might know by now because I talk about it all the time. Your microbiome imbalance. Your body's microbiome in your belly, trillions of bacteria and other stuff, and they're in charge of everything. They are literally in charge of everything. Your immune response, hormones, neurotransmitters, infection control, all happening in your belly. This microbiome, if this world loses its balance, it messes with our ability to manage pain, deal with anxiety, depression, spreads inflammation all over the body, causing muscular discomfort and joint pain in some. So what looks like fibromyalgia may be a microbiome issue, or if you have leaky gut, fancy word is intestinal permeability, or SIBO, small intestinal bacterial overgrowth. Again, these are people whose microbiome are not balanced, and you can be experiencing it in your entire system, thinking you have fibro, but you have a microbiome issue.
Well, she is correct when she talks about the microbiome, and we're learning so much more about the gut-brain axis. That is where the bacteria that are in our intestines and our colon greatly impact how our brain feels. For example, when you eat a diet that is predominantly whole plant foods with a variety of different plant fibers, you will have a healthy gut microflora. When she talks about having leaky gut syndrome, that is again a made up diagnosis. But when we do eat a healthy whole food plant based diet, we can have the production of these short chain fatty acids like butyrate and propionic acid. And when you have high levels of these, this can lead to numbness in the colon. Studies have shown if you give somebody a bunch of this acid into the colon through an enema who have IBS, and then you inflate the colon with a artificial balloon, those who have the pre-loading of these short chain fatty acids will tolerate a higher level. And also there's more research showing the impact of diet on our mental health. And we know that research shows that whole food plant-based have been shown to reduce fibromyalgia symptoms. So she does have the important point of bringing up that diet and our food makes it important, but then drawing into that leaky gut and is bringing up pseudo-medical diagnosis.
Number two, this could be a food sensitivity. And I did a whole talk. There's a difference between food sensitivity and allergies. You may not be allergic to pineapple, but every time you eat it, you might get a headache. It's not necessarily an allergy, it's a sensitivity, or it might make you tired, or it might make you achy. So they are very distinct from allergies. It's not an allergy that you need an EpiPen for. Food sensitivities can make you feel so unwell a day or two later if you're intolerant to the food, even though you're not allergic. Adrenal fatigue. I did several episodes on adrenal fatigue. I won't spend too much time on it right now, but everyone thinks stress is about too much cortisol. But in fact, chronic stress over time actually depletes your cortisol level, making you feel tired, depressed, unmotivated, in pain. Sounds like fibro. Yeah, it could be adrenal fatigue. And then there's something called mitochondrial dysfunction. Again, I don't want to get too deep into it, too technical, but mitochondrial dysfunction basically means the batteries of your cells are going haywire. The mitochondria are the powerhouse of the cell. It's the reason we're alive. It's the reason we're not sick when they're functioning. And if these guys get damaged, nothing feels right. So targeting therapies to help the mitochondria could really be a missing piece. And there's mold toxicity. Mold is everywhere. I did another episode as well about this. And not all molds are bad. And not every person is affected by mold. But there are millions of people who are mold toxic. These people are unable to detox their body from mold. And it creates a buildup. And guess what that feels like? Their job is to rule out other diseases. Your job is not to accept this diagnosis and to keep hunting for actual answers and maybe different types of diseases or triggers that your medical provider is never going to test you for. The bottom line is do not accept fibro as your diagnosis. If your medical provider did all the tests, that's awesome. He or she is an amazing human. It just means they didn't find anything. That's good news. But that just means you keep going. You do not accept it. Now is the time for functional medicine. Whether you work with me or someone like me, we can help you go through all of these potential triggers and help you find the root cause and alleviate your symptoms.
She says it could be mold, food sensitivities, adrenal fatigue, or mitochondrial dysfunction. And this is where the functional medicine claims start piling up fast. Let's go through a few of these. Mold toxicity. There's no credible evidence that common household mold causes fibromyalgia. Yes, certain molds may make some people sick, but that's a separate condition. And food sensitivities. Elimination diets can sometimes help with IBS-type symptoms, but food sensitivities are not the underlying cause of fibromyalgia. And many people who are neurodivergent, autistic, or ADHD are more likely to have sensitivities to food. We talked more about this on podcasts talking about picky eating and ARFID. And what about adrenal fatigue? It's a made-up diagnosis. The concept that your adrenal glands burn out from stress has been debunked in endocrinology for decades. Yes, when you're stressed, cortisol levels can be affected, but that is not the underlying cause. It's more of a downstream effect. And what about mitochondrial dysfunction? It's an interesting theory, but again, no consistent evidence that targeting mitochondria reverses fibromyalgia. These ideas sound attractive because they offer a root cause that can be fixed with supplements or detoxes, but the science doesn't back that up. And this is where patients can get hurt. They spend thousands chasing phantom root causes while missing the proven treatments that do help. So here's what's going on. Fibromyalgia is real, and there is real hope, and there are real solutions that are evidence-based. Understanding fibromyalgia is important. We have learned so much in the last 20 years. We understand that the brain's volume knob gets turned up. Things that aren't necessarily causing tissue damage or harm to our body feel like they do. Imagine your pain system as an alarm. In fibromyalgia, that alarm becomes hypersensitive. It goes off at the slightest touch, and it stays on even after the injury or trigger is gone. It's not all in your head, but it is in your central nervous system. Functional MRI studies show differences in how the central nervous system and brain process stimuli. In a study published by the National Institutes of Health looking at chronic fatigue syndrome, they showed hypoperfusion in parts of the brain, especially with prolonged attempted activity, correlating with fatigue. Studies have shown imbalances in the way the brain filters pain. And add to that autonomic nervous system testing, or the autopilot part of our central nervous system, reveals overactivation of the stress response system. That's why fibromyalgia overlaps with these other nociplastic pain syndromes like irritable bowel syndrome, chronic fatigue, migraines, TMJ, and ADHD and autism, conditions involving sensory and stress regulation differences. And treatment isn't one pill or one lab test. It's a multimodal approach. Getting restorative sleep, gentle aerobic exercising and pacing, and avoiding the boom-bust cycle. Cognitive behavioral therapy or pain reprocessing therapy can be beneficial, as well as neuroscience education, which I talk about on this YouTube channel and podcast, where we learn about the underlying pathophysiology of these central nervous systems and ways to help live better. Addressing ADHD and understanding autism, as well as the role anxiety and sometimes depression plays. For most people, they're not as much depressed as they are frustrated by living with chronic pain and fatigue. And studies are showing that those who have ADHD do well when they're treated for their ADHD with appropriate medications like stimulants. And sometimes medications like SNRIs, such as duloxetine, brand name Cymbalta, and gabapentinoids like gabapentin and pregabalin can help recalibrate pain processing pathways in the brain. That's not giving up, that's science catching up. So should you accept a fibromyalgia diagnosis? Yes, if it's made carefully and other serious conditions are ruled out. But accepting it doesn't mean you stop searching for ways to feel better. It means you finally have a framework that explains your symptoms and points toward evidence-based solutions. You deserve validation and accurate information. You don't need to be told that your pain is from gluten, mold, or your mitochondria or adrenal fatigue. You need care that addresses the whole biopsychosocial, spiritual, environmental approach and how the brain and body are connected, and that the effects of sleep, stress, trauma, and movement and other co-occurring conditions can all have an impact to either turn up the intensity of the brain fog, fatigue, and sleep problems. Appropriate management can actually help reduce this, and overall to help support these underlying conditions goes a long way to help live the best you can with these chronic overlapping pain syndromes like fibromyalgia. So fibromyalgia is real, and there is real hope and real solutions for real pain, fatigue, and brain fog. To this naturopath, you're right that patients deserve more answers, but rejecting the fibromyalgia diagnosis isn't the way to find them. Understanding what fibromyalgia really is, that's the path to recovery. If you found this helpful, hit like and leave your comments below so more people see accurate, science-based information about fibromyalgia and other overlapping chronic pain syndromes. And subscribe if you want more videos like this, where we combine compassion and neuroscience education to help you live the best with fibromyalgia.